If you have or suspect you may have a health problem, or if you require answers to specific healthcare questions or concerns, you should consult your physician or healthcare provider and not depend solely on information presented in this program.
Hello, I'm Dr. Steve Garner, and welcome to Ask the Doctor. It's great to be with you today. This is our 16th season, and as you know, this program was created to assist you in understanding medical issues so you can take charge of your own health. It's more important than ever to become an informed patient, and we are here to bring you timely health discussions. Now, for those who are new to the show, there are two ways to get your questions in. First, you can call our live phone line at 718-499-6101. And second, you can email your questions to askthedoctor@netny.net, and we'll bring them into discussion. For this episode, we really have a great show tonight. We have Dr. Anjalish Kumar. She's a urology attending at New York Methodist Hospital. Dr. Robert Seminara, sitting next to her, is a breast disease specialist at the New York Methodist Hospital. And last but not least, Dr. Michael Abbott. He's got internal medicine training, boards, pulmonary medicine, geriatric medicine, and he's attending at New York Methodist Hospital. And welcome. And it's great to see you guys. We're going to get into discussion a little bit later. We have a new guest, Dr. Kumar, who's never been here, and then two familiar faces to our show. But in the news, we have some interesting stories. Now, one, fat can be a real pain. It seems that people who are overweight have more pains than people who are not. And we're not just talking about arthritis because they're more prone to develop arthritis, people who are overweight, but people who are otherwise have no other problems except that they're obese. And it turns out that the fat creates chemicals that cause inflammation throughout the body. They cause the joints to become inflamed and you can get pain. And it's something that doctors should be aware of, that people who are obese are more prone to pain. And we have to, again, it's one of those reasons why you should lose the weight, and it's just another interesting thing. Now, another one, a fat doctor might cause a problem. Did a study, they found that the doctors who are fat are reluctant to talk to their patients about losing weight, much as those who smoke are reluctant to talk about smoking cessation. So, kind of interesting, I think. What do you think?
Dr. Garner, and it's interesting to bring it out, without a doubt.
Now, what about this blood pressure? This is another story. It seems if you go to the doctor, he takes your blood pressure in your left arm, great, it's 120/80. And then you go out, that's no. You got to do the blood pressure in the other arm. The blood pressure in the other arm comes back 15 degrees or 15 millimeters more than on the other side. Then you have to consider vascular disease, that the patient may have atherosclerotic disease and be prone to heart attacks and stroke. So many doctors take only once. Make sure you insist that your doctor takes it in both arms. And I think that's helpful. What do you think of that, Mike?
Well, I think that, you know, if the blood pressure difference is significant, then you have to worry about a blockage in your blood vessels.
And then allergic to the cold. Who would have known that, right? This is why you got to, be in Florida or Phoenix or something like that. There's actually a real life syndrome where people are allergic to the cold and get hives. They actually get hives. And it can actually be serious, where there's one unfortunate youngster who dove into a pool in some cold place and died, developed hives, couldn't breathe, and died in the swimming pool. So it's something to consider, and we did a story on Fox on this and began to get a lot of questions from all over the country of people who had been describing this. They go to their doctor and the doctor tells them, no, they're crazy, there's no such thing. There is such a thing, and treating it with antihistamines and treating it, giving, if people have really severe reactions, giving epinephrine shots to give are indicated. So it's something to think about. I see Monsignor Bennett is in there. Out of 16 seasons, he's missed one show. So you want to say hello to Monsignor?
Hello.
She can't see, the lights are bright, and he's out there. So Monsignor, thanks again for support. And last week's quiz, I got to get into, it was a little bit tricky, but we received a lot of your emails with your answers. Now let me just refresh for those who didn't watch or forgot the show. Why is the date of Easter always determined by the lunar calendar? It's interesting. All the other Christian holidays determined by the sun, but this one determined by the moon. Some of the earliest emails were from Geraldine, a favorite of ours from Manhattan, who wrote, Easter is the first Sunday after the first full moon after the spring equinox. That's a big answer. But, okay? Alvinia in South Ozone Park, I think she made it a little more condensed. The reason Easter is determined by the lunar calendar is to keep correlation with Jewish Passover. Interesting. Joe from Bensonhurst wrote, Easter follows the Passover holiday, which also follows the lunar calendar. All three of those questions have merit and would be judged winners,
Sure.
but we're going to go by the time that the email was received. So it's a very close race between Alvonia and Joe. Difference by few minutes. This shows you got to get in there, get that touch-tone phone, you know, instead of the rotary. And the winner is Alvonia in South Ozone Park. And we thank you for your question. Did you guys know that?
Did not know that.
Definitely did not teach
So
us that in
Easter
medical
always
school.
comes, right, Easter always comes the Sunday after Passover. So anyway, we have a quiz for this week. And this week is in honor of Groundhog's Day coming up. How many times has the groundhog been right in the history of groundhog?
I think it's
What
about
percentage?
50%. No?
50? 50?
No, it's,
What is
it's actually about 60%.
60, and Dr.
I
Kumar?
think less, 25%.
This is why it's not just a pretty face here. This is why we have her on
the
the show. 39%. 39%, which is it's a kind of a low that he's not doing well, Punxsutawney Phil.
No.
This one, though, is if you go to Texas and you ask for Groundhog Day, they don't know what you're talking about. When you get to Texas, what's the name of Groundhog's Day in Texas, and what's the animal they use in Texas for this? All right, it's an interesting quiz. So remember, tell us what the name of the holiday is in Texas and what's the animal they use. The number to call now for our show is 718-499-6101, and our topics are urology, breast disease, internal medicine, pulmonary medicine, and geriatric medicine. You can also email your questions to askthedoctor@netny.net. Don't go anywhere, we'll be right back.
Place your business on TV by becoming a sponsor to one of NET's family-friendly programs. See an increase in your revenue by reaching a potential audience of 4.3 million viewers in the tri-state area. We have a number of packages available and will even produce your commercial. For information, contact us at the number on your screen and get ready to see yourself on NET.
Welcome back to Ask the Doctors, where our topics are urology, breast disease and surgery, general surgery, internal medicine and pulmonary medicine, and geriatric medicine. And I want to meet the doctors first. Dr. Kumar, it's a pleasure to have you.
Thank you.
It looks like you have a little addition coming soon.
Yeah, that's right. I have about 5 weeks until I'm due.
Wow. Do we know if it's what it is, or you don't want to say?
Well, we think it's a girl.
We think it's a girl. We think it's a
Yeah.
girl. You never can be sure.
That's
until
right.
This happens.
That's
And,
right. That's what I said when they said.
Is it tough to find names? You and your husband going through names now?
We are. We wanted to think of an Indian name,
Oh.
so we've been thinking about that. But I don't want to choose a name until after the baby's born.
Tara?
So
Tara could it be?
we'll see.
Yeah, it's a nice name. And where did you grow up?
Long Island.
Long Island. I could tell that accent. No, but, and you've now come to New York Methodist Hospital where you're doing urology, a female urologist. It's not that common.
No. Right now, practicing, there aren't a lot of female urologists, especially in Brooklyn. But more and more women are coming into the field, and you'll see it in residency programs now. It's about 30% women. So in the future, we'll be seeing many more female urologists.
So I just want to get it straight. Now, you see men mostly for what? Prostate problems?
Yeah, a variety of things. Prostate problems, enlarged prostate, kidney stones, erectile dysfunction, various types of urologic cancers like prostate cancer, kidney cancer, testicular
And what about the women?
cancer.
Now, what do the women come to you for?
The women have similar problems like kidney stones, and then I see women also for issues with urinary incontinence, recurrent urinary
Or like
tract.
after a lot of pregnancies and stuff?
Yeah, or even just one, people who haven't had that many pregnancies can still experience incontinence and voiding dysfunction as they get older. I see them for recurrent urinary infections, for pelvic prolapse,
I
for a
got to
variety
get
of
through
things.
this PSA thing with you and some other men, because I'm so confused with this. The panel's confused. I see you lit a fuse because the lights are all flashing away, so we're going to get to you very soon. And thanks a lot for being here. We appreciate it.
Thanks.
Dr. Seminara, surgeon, breast specialist, and just a great guy who's been with us so many times. What's going on in your life?
Well, I'm a grandfather.
Wow.
I'm a grandfather for the first time.
We don't have any sound effects for that, the hooray? I don't know. Okay, we tried, but it's a low-budget show. Okay, so tell us.
Well, it's just a great feeling. It's a wonderful thing. And my oldest son, Matthew, and his wife, Eva.
Is it the baby sleeps?
The baby sleeps, not too good at catching a ball just yet, but he's doing terrific, and we're just so proud of him, and his mom and dad are doing a great job.
That's great. So everybody knows Dr. Seminara, no need to tell. He's great at breast disease, his great philosophy of breast disease. Just give a quick snippet of that.
Well, the real thing is this. Your show promotes not only good health, but is encouraging people to be proactive. Proactivity is what we want with breast today. There's no question about the fact that still too many people are getting sick and dying of breast cancer. 35 to 40,000 people, are dying of breast cancer in the United States still at this time. So the patients need to be proactive. They need to know things like their BI-RADS readings and communicate with surgeons and their doctors and ask questions. And we'd love to just address that later on too again.
And Mike, Dr. Mike Abbott, who's been with us also a number of times, 3 specialties, right? Pulmonary, geriatrics, and internal medicine.
And critical care.
And critical care for. Tell us what's new in your life.
I'm going to be a grandpa.
Wow, this is a very productive group here.
My oldest son, Stephen, and his wife, Nicoletta, are going to give me a grandchild in July.
Fantastic.
They don't want to know what it is, so, and they don't want me to call and ask, so I guess we're just going to find out.
Just want a healthy baby, right?
Right.
That's fantastic, and we're going to get all these questions. I know the people out there with your blood pressure problems, your lung problems, you're just getting a little bit old and you have some aches and pains. We're going to get into that.
Absolutely.
And I do want to give a shout out to 2 people, if I can remember their names, but in the meantime, I'm going to, Dr. Kumar, your parents are watching.
I think so.
Can you give them a little hello out there?
Hi, Mom and Dad.
And then my banker, Chase Manhattan Bank, which I have to, on Newkirk, Foster and Newkirk. Great people. I have to say hello to Ingrid, who's the manager there, who waived the fees on my overbounce check. And Kathy Rosa, who's a great personal banker. So if anybody needs a bank, anybody has any money to watch after Chase Manhattan on Foster and Newkirk. And now let's see who's calling number 1. You never know. Could it be Maddie, Joel? Could it be Grace? Who is this? Hello?
Yes, it's Grace.
It's Grace.
Hi, doctor. How are you?
Grace, I got nervous. I didn't hear from you for a couple of weeks.
Yeah, well, I haven't been well with my knees with the osteoarthritis. But, doctor, you mentioned you were going to have an ophthalmologist. I don't know when you're going to have that.
I know. It's my daughter, and I'm having a hard time convincing her to come on. I'm going to try next week, okay?
Yeah, but I have a question anyway.
Okay, give it to her. She's watching, maybe. So let's hear. Grace?
Oh, okay. No, I was going to ask you another question, being that there's a regular doctor there. My doctor, we took blood work. Everything's pretty normal. But our vitamin D level is 21, and he keeps saying that it's very low. We drink milk, we eat yogurt, we eat cheese. Why is that? I want to know.
All right, who wants to take? Mike, you want to take that one?
I think a lot of vitamin D3 deficiencies are becoming apparent now. Because of the scare of skin cancer, we're not going into the sun. And therefore, no matter how much milk we drink, how much calcium we take in, how much broccoli we eat, we find that a lot of patients are getting D3 deficient. This can cause and help cause osteoporosis, and you should probably take a vitamin D3 preparation. I'm sure your doctor will give it to you.
Yeah, we did try a vitamin D supplement, but we got sick. We got like an adverse reaction, so we never could have those. We can't take the vitamin D thing.
What is that, you and your husband?
Yes, my husband and I have the same thing, 21 each.
Okay.
And he's out in the sun all day. He's just gardening, he's outside. I stay in because of my osteoarthritis on my knees.
Okay, Grace, so we got to find another one that works.
Right, there might be other preparations and other
Gotta
companies, and keep looking. She'll find it.
Grace, you want to take a stab at the quiz?
Yeah, say that quiz again. It seemed very, very odd. And say it to me again.
Grace, if you go to Texas and you say Groundhog's Day is tomorrow, they're not going to know what you're talking about. What is it called in Texas?
I have no idea, but would the animal be a coyote?
Is it a coyote? Oh, Grace was going for Coyote Day. No, not Coyote Day, but thanks a lot, Grace. I hope you feel well.
Okay, thank you.
I can't believe it's Groundhog Day already, right? Next 2 days. It's amazing, and the weather's 60 degrees. Hi, Maria.
Hi, how are you?
How are you doing today?
Okay. I had called you last week, regarding that I had a doctor's on call from Lutheran Hospital. I've been using them for 2 years. Now all of a sudden they stopped the program, and they said that I won't have it of March 1st.
Okay.
I called Methodist. They say they don't have it.
I thought they did have a doctors on call
I
program.
guess they got rid of all these things. I don't know where to go or what to do.
Dr. Seminara, do you have a tip?
Yeah, there is. You're correct. At the hospital now, we don't have that program. But I really, truly advise you speak to your private doctor about what your needs are. And, if your doctor can consult with some of the people at the hospital, we might be able to find a doctor that could come to your house and visit you.
Right. What hospital are you affiliated with?
Methodist Hospital.
Oh.
You know, you could call the medical board at Methodist Hospital and tell them what your needs are, and hopefully we could turn that around for you and find a way to do that. Okay?
Oh, very nice. I know.
By the way, you're my friend's doctor.
Oh, thank you very much. Thanks, Maria.
Thanks, Maria.
You're great.
All right, thank you very much.
I remember Dr. Abbott made a house call actually after one of the show calls, actually got in touch with the patient.
Yep.
Remember?
Yep.
Yeah. Okay. We're going to go to Lulu's back in town. Hi, Lulu.
Hi.
That's a great name. Is that the official name or is that a nickname?
No, that's my nickname, Lulu. My name is Lucille.
Lucille. Oh, it's very nice.
Now, who am I speaking to?
What can we do for you?
Okay, listen, this is very embarrassing for me. First of all, I want to apologize. I have a cold. And secondly, my question is really embarrassing. You know, I just can't seem to go to the bathroom on my own. I have to keep taking laxatives, like every 4 or 5 days. And then I go like 3 or 4 times.
How about the urine? Any problem with the urine?
No problem with the urine.
Trying to get your questions. Okay.
No problem with the urine. It's
okay.
But, you know, I'm homebound. I'm 81 years old, and I don't get too much exercise because I have arthritis in my knees. So, I mean, I do what I have to do around the house, but I just don't do no exercise, and that's what I...
All right, Lulu, I'm going to ask our surgical opinion and a medical opinion. Surgical opinion first.
Okay, surgically speaking, sweetheart, as we age, very often it becomes harder for us to move our bowels.
Yes.
And as we do less physical or strenuous activity, it also becomes harder for us to move our bowels.
Right.
The rule is this. Almost anything you put in your mouth to help you move your bowels, herbal or some other products like Metamucil, are okay. What we do not want you to do is use enemas and things that go into your rectum to cause you to have a bowel movement, because that could A, be dangerous and could hurt you. So it takes a little time to find out the right amount of things that you could take by mouth. You got to experiment a little bit. First thing is have enough water, probably more than you think you need.
Yeah, see, I really don't drink that much water. I'm not thirsty.
Oh, well, yeah, you need to take water, though. First, we got to get in.
I'm a diabetic.
Even better to have water.
And I know, and I'm not thirsty, really.
Well, water is very important, as well as mild cathartics by mouth, and you should find the proper regime that is going to be perfect for you.
And
You just got to keep searching.
But listen,
What's your diet like, Lulu?
No,
Are you eating enough fiber in your diet?
No, the diet ain't so good because, you know, I'm alone here and it's hard for me to cook. So, you know, I eat a lot of TV dinners, but they say eat fruit, but I'm a diabetic, so I'm afraid about the sugar.
But you could eat leafy green vegetables and salads, and that would probably help you a lot.
Oh, listen, but the suppositories don't hurt, do they? Because if I put a suppository, I'm okay.
I'm going to let Dr. Abbott give one last word, and then we're moving on.
Okay.
Yeah, Lulu, first of all, as you may or may not know, diabetes can precipitate this chronic constipation. You also have to make sure that there's nothing acute going on, but there are some really great new medications that you could take every day that will improve the movement of the in the large bowel called peristalsis.
Right.
And if you go to your doctor, he may be able to give you something. She may be able to give
Thanks,
you something.
Lulu.
Okay,
I hope that
thank
helps.
you,
Give us a follow-up. Let us know what comes, okay?
Okay, thank you.
We're going to, sorry. We're going to Claire now. Hi, Claire. Claire? Claire had the quiz, I think, and then panicked. I'll keep Claire on hold and see if she comes back.
Oh, yes. Thank you.
Claire, are you there? She's on
Yes,
another
I
call.
am.
Am I
Great.
interrupting?
No.
Oh, good, good. What can we do for you?
I just wanted to answer the quiz.
Okay,
I hope I'm right.
let me just repeat the quiz then. The quiz was, what's the name of the holiday that's known as Groundhog Day here? What is it called in Texas, and what's the animal?
I thought it was a gopher, G-O-P-H-E-R.
G-O-P-H-E-R. It's a gopher. Oh, my. I thought you had it there, and but the judges say no.
Okay.
What do you think? You surprised?
I'm surprised I'm wrong.
Yeah. Where are you calling us from?
Richmond Hill, New York.
Richmond Hill. Give us a place out there to have a good dinner.
Oh, gee. I don't know. The Olympic Diner, I guess.
Olympic Diner.
Yeah.
Is it worth a trip?
I guess. Well, it's convenient for everybody around here.
Yeah, it's nice. All
Yeah.
right. Thanks a lot.
Okay. Bye-bye.
Okay, that was, I thought she had it there and she threw us off. Before I get to Lisa, don't go anywhere. I got to ask Dr. Kumar a question to make sure, because I want to know.
Good.
What should I be doing for prostate screening? Should I be going every year? Should I go get any blood tests, or should I just, whatever happens, happens?
Well, the guidelines have changed recently. We used to recommend annual screening starting at age 50, but there have been 2 large trials which came out over the last few months which cast some doubt on the validity of PSA screening for prostate cancer. The validity of the trials themselves is also in question. And ultimately, what it comes down to is a very individualized decision that you make with your urologist about whether you would like to be screened for prostate cancer. And that involves a discussion about the risks and benefits of screening, because there's some risk of overdiagnosis of prostate cancer. In many men, prostate cancer can be an indolent disease.
What is that? What do you mean?
Meaning it's a very slow, progressive disease that you would never feel. You're much more likely to die from something else, and it may never cause you a problem. But it's very difficult to know who those men are. And certainly in younger men, the studies are showing that there is a benefit to screening in younger men, particularly men less than the age of 65, because their lifespan is long enough that even a slow-growing cancer can affect their mortality. So it's a very individualized decision, and the recommendations for screening are now different among different organizations. And so it's a discussion that you need to have with your physician. It's not as simple as sending a test.
Have to have that discussion just before you run to one of these health fairs, or the Daily News doing a health fair. It may be more harm than good.
Well, it's certainly controversial. I think that the U.S. The Preventative Task Force Service wants to say that it's more harm than good, but the studies that they're using to make that statement don't necessarily reflect that, because they weren't necessarily well designed to prove that point. And so it's just a discussion that you need to have with your urologist, and it depends on a lot of factors like your age, your baseline health, and what's important to you in terms of your quality of life and your length of life.
Beautiful. Thank you. Thanks a lot. Let's go to Lisa now, who's waiting patiently. Hi, Lisa.
Hi. It's a pleasure talking to you.
It's nice to talk to you. Is this your first time?
No, the second time.
Second time. And where are you calling us from?
I'm calling from Brooklyn, and I have a question. I'm 74 years old, and in the middle of the night, and every night I wake up to go to the bathroom. I believe it's a weak bladder.
Okay.
My question is, what medications can I take that does not have a side effect?
All right, Dr. Kumar, she has a weak bladder. Get it up at night.
Well, first I just want to say getting up once at night to urinate is actually not abnormal. It's considered normal to need to get up 1 to 2 times at night. As far as medication, the one medication that we usually use to help with urinary frequency does have side effects of dry mouth and constipation. And so if you're really looking to avoid medication, then I would recommend behavioral changes like limiting the amount of fluid that you drink before bedtime, or I usually tell people after 6 p.m. at night, as well as elevating your legs for a couple hours before you actually go to sleep. A lot of people, retain some fluid in their lower extremities during the day, and it helps to just kick your legs up before you actually go to bed to let that fluid come back into your circulation so you can urinate before you actually go to sleep, because it's the disturbance in your sleep that actually bothers you. Also, as you get older, I should mention that your kidneys actually produce more urine at nighttime. So that you have working against you, but if you're only getting up once at night, it's actually not that bad, and I would recommend behavioral changes rather than any medication, because the medications do have side effects.
Thank you so much.
Thanks.
You're welcome.
It's a great help. God bless you. Thanks.
You're welcome. Thank you. We're going to take a short break, and I want to remind you that tonight's number is 718-499-6101. The topics are urology, breast disease, internal medicine, geriatric medicine, critical care medicine, and pulmonary medicine. Don't go away. We'll be right back.
Place your business on TV by becoming a sponsor to one of NET's family-friendly programs. See an increase in your revenue by reaching a potential audience of 4.3 million viewers in the tri-state area. We have a number of packages available and will even produce your commercial. For information, contact us at the number on your screen and get ready to see yourself on NET.
And welcome back to Ask the Doctor, where our topics are urology, breast disease, internal medicine, geriatric medicine, pulmonary medicine, and critical medicine. And we have Dr. Anjalish Kumar. She's to my left. To her left is Dr. Robert Seminara. And to his left is Dr. Michael Abbott. Now let's get back to the busy lines. We got Rita calling. Hi, Rita.
Hi.
Hi. Rita, turn down the things. You got the 7-second delay.
Yes, I did turn it down.
Very good. Where are you calling us from?
From Brooklyn.
Which part?
Borough Park.
Borough Park. Give us a tip out there. If we're stuck in Borough Park, where can we eat?
Either Gino's or Vesuvio's, which is in Bay Ridge.
Gino's, very nice place. We like that. Have you ever been to Gino's? No. You've been to, Mike, yep. Dr. Abbott.
Very good.
I've been to Vesuvio's, which is very good, on 73rd and 3rd.
To go to Vesuvio's, I haven't been there.
Very good.
I'm getting the head's nod from.
Very good. Good.
Very good.
Yeah.
What can we do for you? Do you have an answer to our quiz?
No, I don't know the answer to that.
You think it's a good question?
Yeah, my question is now, I've had a pain in my throat on the right side and in my tongue since Friday. I called my doctor and he said it's viral. He wouldn't put me on an antibiotic. But it doesn't seem to be getting much better. Well, what do I do about that?
Okay. A lot of people having this problem. Sore throat, not getting better. They put you on antibiotics?
No, he wouldn't do it.
No, good. I'm glad.
He said it's viral.
Very good. Dr. Abbott.
My tongue hurt also.
Excuse me?
The tongue.
My tongue hurts too on the side.
What medication are you taking?
What medicines am I taking?
Yes, dear.
I take Topril and I take baby aspirin.
Okay. You know, it's a very difficult problem. Sometimes you can have a fungus in your mouth that can cause some pain and irritation. Sometimes you can have a tooth that's irritating the throat or the tongue. If you don't get better in 3, 4, or 5 days, then you should return to your doctor and see if he wants to give you some antibiotics, see if there is inflammation. What else you can do is you can also gargle with warm salt water.
Yeah, that I've been doing, yes.
All right. And I would do that and see how that works over the next few days.
Thank you for the call. I'm really glad he didn't give antibiotics because that's, remember, a lot of patients demanding antibiotics and causing a lot of problems.
Correct.
Okay. We're going to go now to Robert, who may have the answer to the quiz. Hey, Robert, where are you calling us from?
Hey, I'm calling from East New York. How's everyone today?
Very good, very good. There's nothing, is there any place in East New York to have a dinner?
Not it used to be, not anymore.
No more.
Yeah, not no more. We usually travel out a lot to go eat.
Yeah, where do you go, to the city?
Yeah, go to the city, sometimes Long Island, you know, places like that.
Very nice. So I heard a rumor that you may know the answer to the quiz.
Yeah, I'll take a shot at it. It's called a woodchuck.
Okay, no, wait, we play it up a little differently. We try and get a little excitement here, a little suspense. So, okay, Robert, what do you think is the answer to the quiz?
Woodchuck.
Is it a woodchuck? Oh, Robert, I thought you had it. You're killing us here in the studio.
Doc, I have a question. I see your show a lot, and I would like to know if any of your future shows you're going to have topics for kids with autism and ADHD and PDD, because, you know, that's something that's, you know, it's been, you know, out a lot, and it's a growing trend, you know, especially, you know, on young kids and in minority neighborhoods. I would like to know if in the future you're going to know any topics like that, because I have a son who's ADHD, and let me tell you, it's not easy.
It's tough. So we're going to definitely have a show on that. We'll either have pediatrics or pediatric psychologist on. And we're going to have that probably in April and May.
April, May?
So probably in April.
Okay, definitely look forward to it. Thank you. Have a good night.
Call back soon, okay?
I will.
Go to Jane. Hi, Jane. Jane has been with us before.
Hi, how are you?
How are you today, Jane?
Okay, I wanted to ask the doctor, the breast doctor there.
With the dress, that leaves only one.
Dress, she said breast.
Oh, breast. I'm sorry. sorry. Okay. So what about the doctor?
Okay, I had breast surgery. I went to chemotherapy, to radiation, and now I every 3 weeks take Arimidex.
Arimidex. She's on the radiation following the removal of the tumor?
Right. And what is the question about that? You want to know if is this okay?
No, now my question is the breast under my arm is swelling up.
And how long ago did you have your surgery?
Last February.
We couldn't hear you that
somehow,
good.
I don't know if you're on a cell phone or what. It's very difficult to hear you. When was the surgery?
February.
February.
Okay, well, she had that and she had radiation too, Dr. Garner, correct? You heard
Yes.
her?
Right.
The thing is this, it's very possible that what you're feeling are just the effects of the radiation and the scar tissue. However, I am urging you to go to your doctor, go to your surgeon, and get checked.
I am. They told me you could have radiation dermatitis.
Yes, there are things where the radiation can affect that and make the skin hard and bumpy and nodular, but I won't be happy unless the surgeon that operated on you examines you to know for sure that we're okay. And it probably is little to worry about, and I think everything that's been done sounds appropriate and very good. But get to the surgeon and let's be certain about that, okay?
And I think I have an answer to the quiz.
Oh, wow.
Oh, good.
Okay, wait, you caught us by surprise here. So let me just give you this. The question was, what's the name of the holiday that's known as Groundhog's Day here? What do you call it in Texas? And what's the animal that it's named after?
I know the animal is the armadillo.
Okay, and what's the other part?
The other part I'm not sure, but I know it's an armadillo.
Take a guess, so we need both.
Armadillo Day.
Armadillo Day.
I don't know.
Could it be? Oh, look at that. There's pandemonium here in the studio. I don't know how. Jane, did you know you knew it?
No, I just guess.
It's amazing, because that's Armadillo, and then to get Armadillo Day, I thought was clever.
Armadillo Day, I just took a guess.
Great.
Excellent, excellent. So you are now, is this your first win?
No.
How many times have you won?
This is my second time.
This is the second time for Jane winning the award.
Is there a limit for winners, Dr. Garner?
There's no limit, but we may have to institute one with Jane. We have not had that.
Yeah.
So Jane, where's your current plaque hanging?
In the wall unit in the living room.
And where's this going to keep it company?
Yes, it is.
Very good, very good. We have it, for those who don't know, I don't think Dr. Kumar knows, we have a hand-engraved plaque made in Japan. It's exquisite. And it's wood. Is it wood, or is it maybe like a loose, some kind of a composite wood? Okay, but we spared no expense on this thing, and it's amazing. And there's only about 20 of them out there in the whole country.
Wow.
Jane?
That's quite
Yeah.
an honor.
I'm really glad you won.
Thank you.
Thanks a lot. Stay on the line. We're going to take the information.
Okay, you have a blessed day.
You too. Be well. Watch us on the telethon.
I'm gonna.
Thank you. Let's go now, Patrick, one of our favorite callers. Hi, Patrick.
How you doing, Doc?
Patrick, how are things tonight?
My blood pressure just went up to about 200 over 200.
Why, you knew it?
I waited a half an hour and I had the answer to the quiz.
You know, I think Jane knows somebody here, because I saw Patrick, and then all of a sudden Jane got snagged.
That's unbelievable.
Yeah. Did you know right away, or you had to do a little research?
Immediately. I was talking to my friend Vinny, who's a churchgoer, and he knew right away it was Armadillo Day.
How's Vinny doing?
Vinny's doing good. He hurt himself in the gym last week, but he's doing good.
Very good. What can we do for you tonight?
No, I was just curious, Doc, on that urinary tract infection that my nephew got.
Yes.
After a while, could that turn into something serious?
Well, I'm going to ask Dr. Kumar.
How old is your nephew?
He's 32. He got hurt in a diving accident about 8 years ago.
Paraplegic. Now he's up, walking a little bit.
Okay.
No, he's not walking, no.
Oh, he's not walking?
No,
Oh,
no,
okay.
he's like, yeah, he can't walk at all.
Vinny, I'm getting a lot of feedback. Can you turn off the TV?
Yeah, okay.
Thanks.
No.
Okay.
How does he manage his bladder?
Catheter?
Catheterizes himself.
So he catheterizes himself?
Yeah. Yeah. Whenever I guess he feels when he gets blown up, and he just, he catheterizes himself. And he's got some pretty bad infections over the last few years.
So he's had a few infections?
Yeah. Yeah.
I mean, being that he's on intermittent catheterization, he's certainly at risk for, he's at increased risk for urinary tract infections.
Right.
I hope that he's followed by a urologist to know what his bladder function is like, because in patients like him, we tend to study the pressures in the bladder to make sure it's not having any harmful effects on the kidney.
Right.
It doesn't surprise me that he's had a few infections. Being that he's on the intermittent catheterization, but we want to make sure that those infections aren't traveling up to the kidneys, and that the pressures that he's generating in his bladder don't transmit up to the kidneys.
Right.
And so, I would make sure he's definitely being followed by a urologist who's doing the appropriate studies to make sure that that doesn't happen. But people like him tend to have bacteria in the urine when it's not causing an infection. It's just called asymptomatic bacteriuria.
Right. He had a bacteria in his blood a couple of weeks ago. I told Dr. Garner.
So that's a very serious infection that he needed to be treated for.
Right. Right. He did, and he's better now. So.
I think so. So it's a tough one. It's a tough one.
All right.
It's very tough. Very tough.
I'm sorry, and I hope we hear from you next week, Patrick. Okay.
Thank you, Doc. Do I get a runner-up trophy for that?
Yeah, but don't. I wouldn't go down every day waiting for the mail.
Okay.
Okay. Take care.
Doc.
All right. Now we have a question. I got an email. I got to get this email. And Rita, hang on. This is for Dr. Seminara. Someone who's been having bad rectal pressure and pushing for over a year now. She also has internal and external hemorrhoids. The pressure is so severe, she can't walk. Now she had spine surgery from the 4th and 5th lumbar body. Do you think that the pressure in the rectum could be causing the pain that she's getting?
Well, certainly this does have to be addressed without exception. The pressure can be causing a problem with the rectum and exacerbating, which means making worse the hemorrhoids, and the hemorrhoids themselves can be giving pain that can also give her pain around the rectum. So it's almost like one can be making the other worse. It really needs to get to the doc, and there are a lot of things and a lot of medications that could be done here, and a lot of ways to alleviate a lot of rectal pain that perhaps we didn't have years
just
ago.
throw this in. What's the best way to treat hemorrhoids?
Well, it depends on the hemorrhoid. It depends on what we got. There are times when a person might have a thrombosed hemorrhoid, in which a small incision is great to remove the clot, and others when just changing the bowel habits is all a person needs. And if you don't need to go to the operating room, and it can be treated conservatively, then that's the way it should be.
Beautiful.
Because there can be problems.
Thanks. I got one other. Let me get Louise's in from Queens, 75-year-old female, my name is Dr. Abbott, have a traveling pain. Goes from her arms, the legs, the side. What's causing this? What could be causing traveling pain? I'm healthy. I'm not on any medications. I'm 75 years old. She's got pain on the left side of her body.
Well, I mean, the first thing we worry about, obviously, is rheumatoid arthritis, where you can have some traveling pain, some inflammatory arthritis. But more than likely at this age, it's some type of osteoarthritis or an overuse syndrome. Are you limping? Are you using a cane? Are you carrying something that's heavy on one side? Are you sleeping on that side? And all these things need to be looked at, probably discussed with you and your physician. So I would do that.
Thank you. And finally, I got Jennifer in Connecticut who saw the Fox piece on allergy to cold, had experienced the same pain for over 2 years, and after praying, discovered the problem was underlying intolerance to milk. And she was given an antidote, oranges, the fruit only. Now she's kept under control with 1 or 2 oranges. She's hoping that this can help someone else. So it's a good point. If you're allergic to cold, consider that there may be other underlying allergies. It could be milk. And Jennifer felt that oranges was an antidote. So thanks, Jennifer, for getting that out. Let's get back to the phones. We got Pina. Hi, Pina.
Hi.
How are you?
I am very good.
Good. How are you? How old are you?
I am 31.
31. You have a nice voice. Very young voice.
Oh, well, thank you.
Where are you calling us from?
I'm calling from Queens, Jamaica, Queens.
Jamaica. Okay.
Yes.
And what do you like to eat in Jamaica?
What I like to eat?
Yeah.
Spicy food.
Spicy food. Is there a favorite of yours?
Just chicken curry.
Chicken curry is the name of the store? Very nice. Oh, that's the food. Very good.
Yeah, that's the food, yes.
Yeah. Oh, you like to eat at home, probably?
What I like to eat at home?
Yeah. You like to cook?
Not really.
Oh, okay, okay.
I'm not a good cook.
All right, anyway, so how do you pronounce it, Pina or Pina?
Pina.
Pina.
P-I-N-A. Yeah.
Very good. They put a little accent on top of my screener. Okay, so what can we do for you?
I have been having severe numbness in both of my hands, my palm actually. It's like a tingling sensation, and then it gets really painful. If I try to elevate my hand,
okay, so numbness and tingling.
Painful.
Does anything make it worse?
When I sleep at night, if I angle my hand in a certain position, that triggers the pain.
Okay,
and
so...
it just doesn't go away. It stays all day.
See, if Dr. Kumar, you've been she's fingers are tingling, gets numbness at night if she lies in a certain position.
It sounds like, I mean, I'm just a urologist, but it sounds
no,
like
don't put yourself just a urologist.
It sounds like maybe when you sleep, you're putting some pressure on a certain part of your arm, which is affecting the nerves that supply that part of the hand, and that's why you're having that numbness. So you may be, you know, falling asleep with your head on your arm, or you know, with your arm sort of pinned under your body. That may have something to do with it.
Dr. Seminara.
Yeah, sure, you're absolutely right. And that may be called what we call carpal tunnel syndrome. So you may be having that, and you should talk to your doctor about that, because it certainly sounds like that's what's going on. But go to your doctor and tell him, because if that's it, sometimes a small procedure can really make you much, much better. And sometimes it's a sign of something else. So talk to your doc about it.
Pina, is the pain on this side of the hand and these three fingers mostly, or is it the whole hand?
The whole hand, both hands actually.
Both hands. And how many pillows do you sleep on?
Just one.
Okay. I would, you know, look into maybe getting a cervical pillow. See if you're sleeping a little flatter would help. It could be carpal tunnel, but that usually affects the three fingers in each hand. So
got a lot of good answers here. What we're going to do, Angelo, I know you're next on line 3, but we're going to take a short break, so don't go anywhere, Angelo. And when we come back, we're going to go to the rapid fire segment. This is a very exciting portion of the show where each person takes a question, no matter what the question is, and we go from one to another, and we answer within 1 minute. Okay, so, all right, so don't go anywhere. We're going to take a short break, and when we come back, the number's still going to be 718-499-6101, and we're going to be discussing urology. We're going to discuss breast disease, surgery, internal medicine, geriatric medicine, critical care, and pulmonary medicine. We'll see you in a little while.
Place your business on TV by becoming a sponsor to one of NET's family-friendly programs. See an increase in your revenue by reaching a potential audience of 4.3 million viewers in the tri-state area. We have a number of packages available, and we'll even produce your commercial. For information, contact us at the number on your screen and get ready to see yourself on NET.
Okay, and welcome back to Ask the Doctor, where our topics are urology, breast disease, internal medicine, geriatric medicine, critical care medicine, and pulmonary medicine. Now we're going to get to our questions in a second. How do you like it so far?
I'm having a great
You having a good time? You still having a good?
I love being here. Thanks for having me.
Okay. We're going to talk to Angelo, who's on line 3, and I just dropped someone on line 2. I'm sorry if I dropped you. Please come back and call us back. Angelo.
Hi, hello, doctor.
How you doing?
Good, how's everything?
Okay, you waiting a long time?
Not that long, 10 minutes.
Okay, good. It's tough to get into this show, so I was hoping you'd say a half hour or so, but 10 minutes is all right.
You need to extend the show.
Yeah, what did you say?
You need to extend the hour of the show.
I see my producer pulling a hair out, so tell me about this. Now, what's the problem tonight?
Okay, this is a urology question. I suffer with kidney stones probably close to 20 years now.
Okay.
I've been to different doctors, did kidney studies, because I also have high blood pressure at a young age. And I just want to know if there's anything to help kidney stones pass easy, because I get them basically at least once a year, sometimes twice a year. And they come around the same time, too, like the fall and summer times. And when I get them, I usually have to go in and either get them blasted through, by a lithotripsy or sometimes actually go in and manually take them out. And this is probably
Angelo, we
every
used to
year.
call
Yeah.
this the rapid fire segment, but you've changed the name of the show. So, Liz.
Stones that are less than 5 millimeters in size have about a greater than 50% chance of passing on their own. And so if you are passing a small stone, one thing you can take that may help to relax the ureter and allow you to pass it is a medication called an alpha blocker, one that's commonly known as Flomax. We sometimes give that to people to help them pass their stones on their own, and that can obviate the need for a procedure if you're passing a small stone.
Sounds good? Hope that helps you.
It does. Thank you very much.
Angela, be well. Take care.
Thanks. Bye.
We now have Joyce joining us. Hi, Joyce.
Hi, Doctor.
Where are you calling us from, Joyce?
From Bedford-Stuyvesant.
Bedford-Stuyvesant. And again, out there, not much to eat, right?
No, it's not.
No. You have a question for Dr. Seminara?
Yes, I have a question.
What can
I
we do
have
for you?
high blood pressure, and when I wake up in the morning, it's very high, 148 over 70, or 151 over 70. Then when I start walking around during the day, everything is fine, like 121 over 56 or something like that. I'm wondering why.
Well, first of all, thank God the pressures and the numbers that you tell us are not too bad. And in the afternoon, it comes down, and a lot of people it goes up. So for you, it's just the other way around.
So even though it's 151 over whatever?
Well, 151 over whatever, as you describe it, it could be a lot worse. So I wonder what kind of good night's sleep you're getting or not getting. And I would discuss that with my doctor and speak to him about it, because I got a feeling you might not be getting quite the sleep you think you are at night.
That's right.
Okay.
Thank you, Joyce.
Thank you.
Great to
Bye-bye.
hear from you.
Okay, bye-bye.
Okay, we're now going to go to Marie. Hi, Marie.
Hi.
How are you?
Oh, this question it's not really a question. I just wanted to say that my grandson goes to St. Francis College, and today was his first day working at the Methodist Hospital, and they sent him there to learn radiology. He's a senior in St. Francis.
What's his name?
His name is Paul Aiello, and today he called me up and he said to me, I just passed your famous Dr. Gardner's office. Because I always talk about you.
Could you think of tell him to come by and say hello tomorrow?
He goes on Mondays and Thursdays.
So we'll see him on Thursday.
Yes.
Oh,
And
that's-
I know the name of the animal. I think it's a raccoon.
Raccoon, you ever hear of a dollar late and a day short?
Yeah. Oh, I didn't. Well,
But I'll give you, let's pretend, all right?
am I right? Is it a raccoon?
Is it a raccoon? Oh.
It isn't.
No, no.
Okay.
Your grandson's interrupting you during the show, and you miss it. It's an armadillo.
That I knew.
Oh.
Thank you so much, Doctor. And I'm going to tell him to pass by your office.
Tell him to pass by.
I will.
Okay.
Thank you.
Take care. But I don't understand if she knew it. Why'd she say?
I don't know, Dr. Gardner.
Okay. Now we're going to go to Joe. Hey, Joe. Joe.
Yes.
How are you?
All right.
Where are you calling us from?
Bensonhurst.
You waiting to talk to the doctor?
Yes.
Okay, you're ready. Let's go.
Okay.
Okay. Joe.
Yeah.
What's the question?
I'm taking the medication Thorazine, and I want to know with a urologist if it affects sexual function.
Okay, Thorazine and sexual dysfunction. We're having
major tranquilizer.
having a little discussion, a sidebar we call this.
It's
Okay.
Mike's turn as the
It's
round
actually
goes.
Mike's turn,
It's
and you
Mike's
should get
turn.
help. You can call in a friend if you want, Mike.
You can call a friend.
How many?
It's rapid fire.
It's rapid fire.
No,
so
I can get help. I can call a friend, or
You can
phone a friend.
Sure.
Okay, Joe. Here we go. Here's the answer.
Joe, yes, Thorazine is a major tranquilizer. It causes a lot of effects on the nerves, and it's well known to cause sexual side effects. Absolutely can.
Joe, I hope that helps you.
Yes.
Okay, we're going to move on. Thanks for the call. I appreciate it.
Okay.
Thank you. We now have Janice. Janice.
Hi.
Hi, it's a beautiful name.
Hi, doctor. How are you?
How do you say that?
Janice.
Janice, sort of like Angelique.
Yeah.
Janice.
Yes.
What can we do for you tonight?
I have a breast cancer like a couple years ago. I don't know. Want to know about the other breast.
How old are you?
59.
59. So, Dr. Seminary, did you hear? Did you have
I
breast
didn't hear the question. You had breast cancer?
Yeah, I'm a breast cancer survivor.
How long ago was that?
95.
95, and you're worried about the other breast?
Yes, I've noticed like a little. Yes.
Okay. Well, what I want you to know, and I want everybody to know out there too, is this: that if you had breast cancer, you're at higher risk for getting breast cancer, not only in that breast, but in the other breast too. So, whenever you take care of a woman with her breast, whether it's breast cancer or just surveillance, it's never a one-time deal. You have to come back and be checked. And if you had breast cancer and were treated, you still should be going back to your surgeon periodically to be checked. And absolutely, I want you to go back to your doctor and have a breast exam and or x-rays like mammogram or sonogram or whatever you may need.
I hope that helps you.
Thank you so much.
Be well. I hope everything is well.
Thank you. Thank you. You guys have a happy new year.
You too.
Same
Thanks.
to you. Thank you.
Hi, Lorene.
Hello, doctor.
Hi, is that the correct way to pronounce it?
Yes.
Beautiful name also.
Thank you.
What can we do for you?
I have two questions. I'm supposed to have knee surgery, and I'm looking for a good doctor.
Okay, and what's the second question?
And the second question, I have, my eyes, watery eyes, really watery. It's like I'm crying.
Okay, we got to have only a minute to answer this, so I'm going to turn to Dr. Abbott. Tell me about watery eyes.
Well, watery eyes are usually caused by allergies. Allergies can cause watery eyes. There are some other problems with eyes. Tear ducts can be blocked, and that could also cause it. But I would see an eye doctor and make sure.
And we're going to get you a referral from Dr. Seminara for a knee?
Absolutely. I'd like her to call the medical board office.
Actually, we have a good one
at
of the doctors.
5110, and we can give them that referral.
Excellent. Dr. Reggie Manning, who's a knee specialist, been on the show many times. Dr. Reggie Manning.
Dr. Reggie Manning.
Okay?
Reggie Manning?
Yes.
Okay.
Thank you.
Okay.
Bye. Let's go to Anne-Marie. Hi, Anne-Marie.
Yes, it's Anne-Marie.
How are you?
I'm okay.
I want to get the question in quickly. So what's the question?
Yes, I would like to talk to the urologist regarding my problem because twice I went to the doctor and the doctor, after he passed for my urine, he found blood in it. And I would like to know why, because when I pee myself, I check on it and I don't see it. I don't know how this happened. Can I have some explanation about that?
Sure. What you had was blood that was found on the lab test. So they saw some red blood cells on the lab test, but you don't actually see it in your urine, and that's called microscopic hematuria. In a lot of people, depending on risk factors like your age and smoking, there is no actual cause for it, but we always do a checkup to make sure it's not being caused by something like a urinary tract infection, kidney stones, or a tumor in the bladder, or anywhere in the urinary tract.
You know, I hope you got a lot out of that because we're out of time. We have to call it a night. So,
all right. Well, good question.
It was a good question, and I think you got most of it in there. And I want to thank Dr. Anjalish Kumar, Dr. Robert Seminara, and Dr. Michael Abbott for coming in. We hope we're able to help you, and it's good to remember you should always be proactive about your health. Speak to your doctors about your concerns and go for, like we said tonight, go for second or third opinions if you need to. Visit our website at netny.net/askthedoctor, and here you can read the Tablet Weekly column. You can watch past episodes. I want to thank Dr. Linda Lapatosa, our quizmaster, and I want to thank you all for your questions. Remember to tune in tonight at 10 o'clock for the encore presentation of last week's show. Very important, good show. For now, I want to thank everybody for coming in. I want to say goodbye, stay healthy, and I'll see you in the tablet.